Let's talk about 5 little-known facts about fish oil as a source of omega-3 fatty acids, EPA and DHA. Fish oil should be your major source of the omega-3 fatty acids, in addition to consuming fish, because it's the most effective way to get your EPA and DHA. And it has so many beneficial effects that are crucial to your overall health. So I make fish oil as a source of omega-3s a primary component of my Wheat Belly and Undoctored programs. So the first little known fact is that one of the most beneficial effects of the omega-3 fatty acids from fish oil is that they subdue the postprandial rise in lipoproteins. Let me tell you what that means. When you consume a meal, you flood your bloodstream with breakdown products from that meal. So the blood is flooded by these particles, typically chylomicrons and VLDL. Well, these particles can contribute to heart disease, among other effects, blocking insulin, for instance, causing insulin resistance. So the big rise in chylomicrons early after digestion, and then later a surge in VLDL, or very low density lipoproteins rich with fat, can cause heart disease, but the omega-3 fatty acids subdue the rise of both, quite a bit in fact. One of the reasons why is omega-3 fatty acids have been shown to activate the enzyme lipoprotein lipase that lines the arteries of your body and accelerates the clearance of these particles. So, especially VLDL. And so there's a subdued effect of postprandial particles by fish oil, which contributes to a reduction in heart disease risk. Another little known fact is that it's the DHA primarily that provides you with preservation of brain health, protection from cognitive impairment, such as occurs in the various forms of dementia like Alzheimer's dementia. Well, that's important to know because there's a prescription form of fish oil that contains no DHA. And that means if you were prescribed this prescription form of fish oil, you'd have to take fish oil to get the cognitive preserving effects. That's kind of stupid, isn't it? If you take a preparation that only has EPA, if you want the brain health preserving effects of fish oil, you have to take fish oil on top of that EPA, which is kind of stupid, isn't it? Why not just take fish oil that contains both at a sufficient dose? Another fact most people don't know about. How did primitive humans obtain omega-3 fatty acids? After all, they're essential, right? If you don't have any omega-3 fatty acids in your life, you'll develop a very severe deficiency syndrome and then die of some peculiar disease. So humans need omega-3 fatty acids, but how did primitive humans obtain it? Well, if the primitive culture was coastal or marine, they would eat fish and shellfish, and they get plenty of omega-3 fatty acids. But plenty of human populations didn't have ready access to marine life, to fish and shellfish. They lived inland and maybe didn't want to walk the 25 or 50 miles to the nearest ocean or lake. Maybe they got their water from a small stream or something like that. So how did they get their omega-3 fatty acids? They ate the brains of animals. Now, that makes modern people very squeamish because we live in an age where we don't eat liver or heart or tongue or brain. But you know what? Your grandmother or great-grandmother was very comfortable with that. If they're still around, ask them. And they'll say, of course we ate it. If you watch the behavior of primitive humans who are still hunters and gatherers, you'll see they readily eat the liver, sometimes raw. They eat the intestinal tract, sometimes raw. And they eat the brain, which is soft and apparently very digestible. But most modern people have become so squeamish in our saran-wrapped, microwavable, served through a drive-through window sort of existence that the idea of consuming brain is just off the chart disgusting for most people. So what we do, of course, is we do the second or third best, which is take fish oil capsules and or consume some fish. Another little known fact about omega-3 fatty acids in fish oil is that it's very helpful for a genetic pattern called lipoprotein A. Lipoprotein A is a genetic variant. It tends to occur in people who are very slender, very athletic, tend to engage in long-term physical activities like long-distance running, long-distance swimming, long-distance biking. These people, oddly, tend to be very good with numbers. So a lot of people with lipoprotein A tend to be accountants, analysts, electrical engineers, mathematicians, physicists. People are very, very good with numbers. These people are also very tolerant to periods of food deprivation and water deprivation. Now, think about that. These people love long-distance running, are very smart, are tolerant to deprivation. I think lipoprotein A is a survival advantage. So I call people with lipoprotein A perfect carnivores. These are people who would thrive in the wild, where you're competing with other predators, you're competing to get prey, and I think these people are better at surviving. And in fact, lipoprotein A has been enriched in the human population. The downside, however, is that people with lipoprotein A are much more prone to cardiovascular disease, both heart attacks and strokes. It's not uncommon to see families where heart attacks, for instance, cluster in the males in their 30s sometimes, and 40s and 50s, and the females in their 50s and 60s and 70s. So it's an aggressive cardiovascular risk factor. Now, wait a minute. Why would it be a survival advantage in some settings and a survival disadvantage with excess risk for cardiovascular disease in other settings, a modern setting? Here's my theory, yet to be proven, but this plays out very well in practical life, and that is, despite being a survival advantage, living in a modern world where we're exposed to grains rich in amylopectin A and sugars. So these are long-distance exercising, slender people who you would think would be very resistant to type 2 diabetes and insulin resistance and those kinds of things. Well, these people, despite being fit and slender, are extremely susceptible to the effects of grains and sugars. So you can have, let's say, a male who's 5'11" and 140 pounds, which is very skinny, right? Very slender. And this person can have diabetic blood sugars from eating grains and sugars, despite being slender and fit. So they are susceptible, like all of us are, to the amylopectin A of grains that raises blood sugar and insulin, and to other forms of sugar, but they're more susceptible than other people. And so these people develop heart disease sooner than other people because the exposure to amylopectin A and sugars provoke wild formation of small LDL particles that cause heart disease, as well as insulin resistance and high blood sugars. Now, one of the most powerful strategies for lipoprotein A is to take a high dose of omega-3 fatty acids from fish oil. I've been doing this for about 15 years and it's proven very, very effective. We have preliminary evidence that this does indeed work, but we've been putting it to work in a practical way, and it seems to really offer people with this genetic pattern lipoprotein A advantage. So we use 6,000 milligrams of EPA and DHA, even though I advocate most people take 3,600 milligrams of EPA and DHA per day, divided in 2 doses. By the way, if you think you might have lipoprotein A because you fit that kind of bill of a slender, intelligent, tolerant to food and water deprivation kind of person and a clustering of heart disease in your family, it's just a blood test. Get an NMR lipoprotein panel and add a lipoprotein A. You don't only need to check it once because it's a genetically determined pattern. We don't try to reduce it. We simply try to reduce the associated abnormalities that bring out the heart disease causing potential of lipoprotein A, such as small LDL particles, high VLDL particles, insulin resistance, and some other factors. Another little known fact, just how do we know how much fish oil and thereby omega-3 fatty acids you really need? Well, one thing you don't want to do is follow the instructions on the bottle. That's nonsense information, has no basis in reality. Well, one of the ways to be guided in knowing how much EPA and DHA to get is by checking a blood test. And you don't have to do this. I'm just telling you how this blood test guides us in knowing how much people should take. The blood test is called an RBC omega-3 index. It measures the amount of fatty acids occupied by EPA and DHA in the red blood cell membrane, because the fatty acids in the red blood cell membrane reflect what's in other cell membranes throughout the body. So we know that the average American, who doesn't get much in the way of omega-3 fatty acids, except for maybe occasional fish consumption or a little bit of the linolenic acid from flaxseed or chia or walnuts, gets converted to the omega-3 fatty acids, but that only a little bit does get converted. And so most modern Americans have a level of omega-3 fatty acid of about 2 to 3%. Likewise, vegetarians don't consume fish or shellfish, tend to also have very low levels. They can try to amp up their intake by doing such things as eating more flaxseed and chia and walnuts, but the conversion of linolenic acid to EPA-DHA is so low as to not be all that helpful. Now, the evidence supporting higher levels of RBC omega-3 indexes come from observational evidence. Now, we have to be careful when we look at observational evidence because sometimes observational evidence is not very solid, not very reliable. But in this case, because there's a graded effect, it tends to support the idea that there really is a cause-effect relationship, despite being only observational evidence. So we know that people who have an RBC omega-3 index of about 6% or higher, so much higher than the average American, has much less sudden cardiac death, which is an important finding, right? We also know that people who have an RBC omega-3 index of 10% or greater, that is 10% of all fatty acids in the red blood cell membrane are occupied by EPA and DHA. When you get to 10% or higher, there's a marked drop-off in heart attack and other abrupt cardiovascular events, as well as dementia. So that graded effect suggests there really is a cause and effect relationship. Now, you can go out and get yourself an RBC omega-3 index, but I can tell you, if you simply follow the guidelines I've been providing through my Wheat Belly and Undoctored programs, where we try to get 3,600 milligrams of EPA and DHA per day divided in two. That's not the dose of fish oil, remember. That's a dose of EPA and DHA contained within fish oil. That almost always generates an RBC omega-3 index of about 10%, sometimes higher, depending on your body size, depending on absorbability of the preparation you're taking. So those are 5 little known facts about fish oil that I hope will empower you in understanding how to put it to use. If you want to know how omega-3 fatty acids fit into an overall program for magnificent health and slenderness, I'd invite you to follow my programs. The easiest way to get started, there are 2 ways. One is to get my recently released Wheat Belly Revised and Expanded Edition that has the entire program that includes omega-3s and many other things that's out in bookstores now. If you just want to, don't care about the why this works, just the how, do this on day 1, do this on day 2, I have a Wheat Belly 10-Day Grain Detox book and an accompanying Facebook page where we guide you through this whole process, including how to manage the opioid withdrawal syndrome that begins when you first eliminate all wheat and grains because of the removal of gliadin-derived opioid peptides.